Good morning.
Morning.
Today I'm here to talk about education. In nursing, as some of you might be aware and some of you might not be aware, there are three ways to become a nurse, three educational pathways. One is the Associate Degree Nursing, or the ADN program. The second is the Baccalaureate program, or the BSN. And the third is the Diploma program. Now, nursing is unique among healthcare professionals is that we do have three entry levels into nursing. Other healthcare professionals have only one entry level. So the question is this a good thing for nursing or is this a bad thing for nursing? A lot of people are starting to think this is a bad thing for nursing because it's not showing us as a professional. So today I'm going to talk about why baccalaureate or a BSN nurse should be the preferred entry level for nursing. First of all, let's talk about how to become a nurse. As I said, there's three programs. First I'll talk about is the ADN program. That's done at the community college level. There's advantages to this. It's generally the cheapest way to become a nurse. It takes 2 or 3 years depending on how many prerequisites you have to do. And community colleges are pretty close to most people, so students are able to go to community colleges pretty easily. You can also enroll part-time in some of the programs, and it's a quick way to get into nursing. The second way to get into nursing would be the baccalaureate program or the BSN program. Baccalaureate programs are in colleges and universities. They are generally more expensive than a ADN program. And they're also not as convenient to the students. Most students have to either drive long distances to get to a university or they have to live on campus, which will, of course, add to the costs. It's also a little bit more difficult to get into the colleges and universities than it is, especially if you're a non-traditional student. The third way to get into nursing is the diploma. Diploma programs are hospital-based. They tend to be more practical knowledge than theoretical knowledge. They were once the #1 way to get into nursing, but with the advent of ADN programs and BSN programs, now there are only very few diploma programs left. So that makes it a little bit more difficult to get into. So with our three ways to get into nursing, why should we worry about that? What's the problem with that? Well, other healthcare professionals in the hospitals, such as pharmacists, physical therapists, occupational therapists, speech pathologists, doctors, need to have at least a baccalaureate degree, if not higher. Physical therapists, I know, now need a PhD to be an entry practice into their physical therapy. This leaves nursing, who is the greatest number in healthcare today, and also with one of the larger scopes of practices, is getting to be the least educated member of the healthcare team. And do we really want to be the least educated members of the team? I mean, think about it. Your physical therapist has much more, at least, book knowledge than you do. So, what can we do about this? Well, there's been arguments raging for many years, even back when I was completing my ADN degree back in 1987, about baccalaureate programs being the entry. But according to Starr and Edwards, there are good reasons for baccalaureate nurses or BSN nurses to be the preferred entry method. Some of these are bachelor nurses have more job satisfaction. They have a lot more room for growth. They can apply for other jobs, whereas ADN nurses and diploma nurses usually are not going to get promoted unless they do go up to a baccalaureate. And the final reason is, I can't think of it right now, but I'm sure it was a good one. So, Now I'm totally lost. Other reasons to become a baccalaureate nurse. According to Starr and Edwards, in their article, Why Should I Get My Baccalaureate? Nurses who have BSNs have much more of a theoretical basis. They get the practical knowledge, but they get the theoretical knowledge in their nursing research classes, in their informatics classes, in their economics, their community health. This gives them a big world view, and don't make me laugh, Dawn. That gives them a bigger world view and allows them to do the all-important critical care thinking, which is what everybody wants in your bedside nurse, to be able to think critically. The research also lets them work with evidence-based practice. And studies show that the more nurses that are a BSN in a hospital shows a decrease in mortality and failure to rescue with the patient. So for every 10% increase in a bachelor's degree nurses, you have a 5% reduction in mortality and failure to rescue. And that comes with the critical care, with the critical thinking. So, how do we become BSN nurses? It's really impractical these days for everybody to be a BSN nurse, and there are some places such as North Carolina and New Jersey that are recommending the BSN in 10, which means if you get your ADN nursing, you should be required to get your BSN within 10 years after receiving your ADN program. Hospitals are also recognizing the need to get bachelor-prepared nurses. They are doing this because hospitals want to be magnet hospitals now. And the more nurses you have as a BSN at the magnet level, the better you look. Hospitals are then reimbursing nurses to get their bachelors. One of the ways they're doing it here at Good Shepherd would be the ACE program, which is Advancing Careers Through Education, which will pay $8,500 a year for nurses to go and get their bachelors. They make it easy. Universities are also helping with this problem by doing RN to BSN completion programs, such as the one I took at Olivet. These may be a traditional, where it's all classroom work. It may be a hybrid, which some of the classes are on ground, some are online, or it may be a completely online program. But the universities are beginning to work with the nurses in the hospitals to get more of a bachelor's degree nursing. So, we need bachelor degrees. We need nurses who are BSN trained. We need them for patient safety. We need them to rescue our patients. We need them to be able to critically think at the bedside. Like I said, this has raged for decades, this whole debate, but now is the time to amend the Nursing Practice Act so we can get our BSNs, and BSN would be the preferred entry level for nursing. Thank you.